So the 10-bed ICU project is constructed on 5 pillars, as you saw in the video. And the first pillar being the equipment that we launch in the hospitals. We not only we order them, we deliver, we install, and we train the people on the ground on the equipment. The second, of course, is the CARE award-winning technology, which is a cloud-based platform. You can see in that graphic, a little bit like Meghalaya, land of mountains and clouds, but this is a different kind of cloud. We'll talk a little bit about what this technology is, what the magic of this cloud technology that connects all your hospitals across the state. Third, of course, the tele-ICU hub, in order to handle the acute shortage of specialists. We'll show a little bit more about that. The training that we conduct, comprehensive, not just medical, but also other aspects. And lastly, of course, the community participation that we bring in to get the local community involved. So basically, on the medical equipment side, about 26 pieces of equipment, high quality equipment are shipped to each of your hospitals. Hybrid ventilators imported from Hamilton, Switzerland. These are AI ventilators which are able to auto-wean the patient based on CO2 levels and the tidal volumes on your chest. So even if you don't have sophisticated specialists on the ground, they are able to take care of the patient and auto-wean the patients. So this comes from Hamilton. The blood analysis comes from Siemens, 5 paramonitors, ECG machines, X-rays, Fowler beds, syringe pumps, infusion pumps. All of this is very high quality equipment that is deployed with a 3-year warranty. The CARE platform that we talked about, this is something that we have spent about 2 to 3 years building, but today it is a very robust electronic medical record that is able to handle everything from patient administration to health information, treatment plans, lab information, facility management of wards, provider management of doctors and nurses, asset management of all the assets that have been deployed. This is a full-fledged system on open source that is available to the government of Meghalaya, and it's running on the cloud. And it has been, Google has donated 1 year of free access to the state of Meghalaya. The CARE platform also comes with a state dashboard. Many of our chief ministers in several states have this dashboard on their very office. We encourage Chief Minister Sangma to also have such a dashboard for Meghalaya showing up on your office, sir, where you will be able to see the number of patients that have been admitted across the entire state, the state they are in, the breaking up on female and male boundaries, and so on and so forth. All of this data, bed occupancy, the number of consultations had, all of this is available dynamically in real time. Of course, it has won an award by the United Nations as the 50th Digital Public Good. And moving quickly to the tele-ICU hub, we're very happy to launch 2 tele-ICU clusters in Meghalaya, one in Garo Hills and one in Shillong. The Garo Hills is live, Shillong is yet to be operational. And as you will see today, we will show you a live demo of Dr. Francis, I think at Garo Hills, connecting up to a spoke hospital, perhaps Williams Nagar or one of the hospitals, and actually treat a patient. We'll show you how this is actually done using this cloud technology, the kinds of features that we have provided, the doctor-to-doctor video communication, the high-resolution cameras that have been put on the ICU wards, the electronic medical records that are available for the medical specialists at your medical colleges and tertiary hospitals, as well as the 5 paramonitor integration, deep integration, so that at the hub, the time series data of the patient can be seen, whether it's SpO2 levels or BP and temperature and so on. So today we will see at Jangal Subdivision Hospital at the West Garo Hills, the tele-ICU hub in operation. And you will see our specialists using our equipment and connecting up with patients in spoke hospitals. Here you're seeing one of them, the Joy Civil Hospital along. There are many others. On the training aspect, we basically have training on the medical equipment, basic critical care training, advanced life support training on the clinical side, and the CARE software training. And we'll talk a little bit about another module of training that we are trying to bring on board. This rigorous training is truly what differentiates this project. This is not just about putting technology or creating infrastructure, but this is actually about improving the capacity of our doctors, nurses, and medical staff in order to improve patient outcomes across the state. Lastly, but not least, community participation. We are creating Rogi Kalyan Samitis in the local communities. We are partnering with the Population Foundation of India, and they are guiding us on the community processes, especially related to accountability. So these are the 5 pillars that we normally talk about at a chief minister's launch in each state. But today, we have very exciting news on advances that we have made in the last about 12 months. So I want to talk about 5 new advances that we've made and then wrap up. The first is we are connected to the Ayushman Bharat Digital Mission grid. So we'll talk a little bit about what that means. Number 2, we have created standard ICU protocols to improve patient outcomes. And we'll talk a little bit about how our clinical group from all around the world, literally, all the states coming together have created these standard ICU protocols. We'll talk a little bit about that. Third, smart ICUs. Can we take existing legacy ICUs and upgrade them to the 10-bed ICU quality? So we'll talk about that. This is the smart ICU project. Number 4, we've been working on generative AI. You've all been probably using ChatGPT and so on. So we have partnered with OpenAI as well as Google, and we are trying out 2 different tools. One is the AI nurse assistant, and next the AI diagnostic co-pilot for doctors. And we'll show you, this is initial work on these 2 projects, but we will show you perhaps some demos of these. Firstly, the Ayushman Bharat Digital Mission, National Mission, Digital Public Infrastructure for Healthcare in India, and CARE is connected to Ayushman Bharat Digital Mission. And we are milestone 1 compliant, where ABA number creation and the people with existing ABA numbers can avail of all the facilities in our ICUs through CARE. It is milestone 1 compliant. Milestone 2, if you are a health information provider, one of your hospitals, you can share the record of a patient with another hospital where the patient has gone to with patient consent through ABDM integration. This is also complete, HIP integration. Then milestone 3, HIU. If you want to get information from a patient, digital records from another hospital, you can do so with patient consent. And by the way, this works across government hospitals and private hospitals that are participating in the ABDM system. And last but not least, the HCX, health claims processing. The hospitals can submit claims with the insurance companies, whether it is the Ayushman Bharat Digital Mission ABDM insurance from the center, or it is your chief minister's insurance cover in the state itself. This can be made to work through HCX. And I want to today announce the National Health Authority has certified CARE in Meghalaya for ABDM as of 2 days ago. So we are live with ABDM in Meghalaya. Secondly, standard ICU protocols. A fantastic team of doctors have come together to identify a short list of conditions for which a lot of patients come to our ICUs nationally. It could be shocks, septic shock, it could be cardiogenic shock, it could be cardiovascular events like STEMI, ST elevation with myocardial infarction or atrial fibrillation, or acute respiratory failure and so on, pulmonary conditions, or it could even be a snake bite. Okay, we see a lot of cases of snake bites, diabetic ketoacidosis, and so on. For each of these, our team of doctors is working on a standard ICU protocol. And we'll talk a little bit about it. So here is a chart of a shock protocol, where whether it is a septic shock or whether it is cardiogenic shock, is you'll able to identify using this. And it's very useful for nurses to have these posters on the ICU wards in order to follow some of these protocols. Even though they're trained on it, there's a lot of detail on the flow charts and the drug dosing information. And this is very, very useful for nurses and doctors. So we are providing these posters for them to use. And other very interesting thing, since we had created this content of standard ICU protocols, we looked at using AI in order to take these protocols and convert them into reference text so that the large language models like GPT, like Gemini, and so on could actually use these to answer questions that the nurse asked in their own language. You can ask the question in whether it is in Hindi or Tamil or and so on, different languages. You can ask the question in your native language and get an answer accurately back, right? So this is an attempt that we are making with OpenAI and Google, but it's in early stages. This is an assistant tool. This doesn't replace doctors or nurses, but it helps them. So this is under test. Doctors from across the country are working on it. Dr. Padmasree Srinivasa is our head of clinical who sits in California, and she is guiding this entire team. And we have Dr. Shiri and Dr. Atul in our project itself who are part of this project. Dr. Rakesh, he's at Janims in Imphal. Dr. Akre is at Kohima. Dr. Madhusudan from Mysore in Karnataka. Dr. Shishir Jadhav is from the KCDH, Koita Center of Digital Health, IIT Bombay, and Moita has been helping publish these documents. So thanks to this entire team that put together these. And the next part is the Smart ICU project. We are trying to see if we can take existing legacy ICUs that you have and upgrade them to all the facilities that we are talking about. This is again a very important project where we can convert your existing older ICUs. Of course, there is work that we need to do. We have to connect to your devices and so on, which might be non-standard, but this is a very exciting project we are taking up. So with this, these are the innovations we're taking up. Before I hand over, I want to say, the Meghalaya 10-bed ICU donors, I want to thank Vinod Khosla, who's just joined us, I guess, from California. I see him on the screen. He is, in fact, funded about 10 of the 14 hospitals we're going live with today. I want to thank HDFC Bank Parivartan, Shashi Jagadishan, the CEO of HDFC, and Kaiza Barucha, the CSR head, have all been very, very instrumental in making this happen. And we thank Google Cloud for giving us a free access for 1 year to the state of Meghalaya. We thank Hamilton Medical for donating 1 ventilator for every 2 we buy. So these are our donors today in the state of Meghalaya. Of course, our team has some fantastic, highly dedicated people. I want to call out Pisoya Leutenbaum, who is the national coordinator for rolling out our project across the country. She's done a fantastic job. You've all met her. We have Dr. Padmasree Srinivasa, I mentioned, head of clinical. We have Sujata on the financial side. On the technology team, largely based out of Kerala, we have Aparna Satyanathan, Jijin Chandy, and Bodhi Thomas spearheading the effort. They are incredible folks. Chandraban is heading the Northeast coordination, and our entire team, all those wonderful ladies you see up there on the first row, they are all state coordinators. They run our project in every state. Dr. Aneri, Iba is in Meghalaya, Sarita is in Sikkim, Kajal is in Manipur, Ashramita is in Pondicherry, and so on. So we have a fantastic team. I want to thank them for their fantastic efforts. Of course, this is completely philanthropic. Every piece, whether it's the medical equipment, whether it's the software, whether it's the training, all of this is not-profit work. E-Governments Foundation that I started with Nandan Nilekani 20 years ago is spearheading this effort along with Karuna Trust. Dr. Sudarshan is there representing Karuna Trust today. The donors, of course, Vinod Khosla, HDFC Bank Parivartan. Other projects have been funded by Crypto Relief, Give India, and so on. The partners, as I said, Hamilton Medical and Google have donated their products. KCDH and IIT is working with us, the Population Foundation of India, and People First is giving us fantastic software engineers. With that, I just want to say we are today in 206 hospitals, 10-bed ICUs in 9 states, over 2,000 beds being managed in 9 states. And today we go live in Meghalaya. With that, I want to thank you, Chief Minister, for giving us the opportunity, and we look forward to working with you. Thank you.